All right, I'm just letting a couple of people on here. Hi, Deb, welcome. I'm just keeping everyone muted just so you guys know for the sake of the recording and everything. And after we finish this portion that's live, I'll open it up for those of you on Zoom to ask any questions at the end. I'm just going to go live here on Instagram. We're doing all the lives today. All right. Welcome, everyone. Welcome to Dinner with the Doctors. I'm so glad to have you all here. Just some little housekeeping before we begin. How these lives work is we're live on both Instagram and Facebook. Feel free to share this. The recordings will be posted after. And please post any questions you have, either if you're on Zoom or Facebook in the comments, or on Instagram, drop a question in the little question box. I will do my best to answer these. We also have our office manager, Damien, on hand, and Dr. Kira, I think, will be joining us in a bit to hopefully answer all of your questions. And if not, we'll make sure to get to them after and respond to you individually. So welcome, everyone, on today's live. This month, Dinner with the Doctors, we are talking about mental health. What a topic for 2020, right? 2021 now. So just a little introduction before we get started into like the meat and bones of this presentation. If you don't know me, I'm Dr. Abby Kramer. I'm one of the chiropractors and holistic doctors at Be Optimal Holistic Health Center. We're located in Glenview, and our mission is just to bring holistic care to everyone in whatever way that works for them. So that's part of our passion in doing these monthly free workshops. Normally, pre-COVID, we do them in person and also stream them, but now they're online, which is actually really nice. We can reach a lot of folks. We have all different sorts of services. So outside of working with one of the doctors, Dr. Carrie Jacobson and myself are the two chiropractic kinesiologists. We also do a lot of work virtually via telemedicine with patients. We also have an amazing doctor in acupuncture and Chinese medicine, Dr. JR. He also does a Dinner with the Doctors every month, so definitely check that out. It's usually the last Tuesday of the month, but you can find all of that on our social media and our website. We have an amazing holistic esthetician to do all of your skincare needs that uses amazing products and is just brilliant. We have foot detox, ionic foot detoxification for people just wanting some overall detox support. We have a reflexologist and so much more. So it's our mission to have all these different offerings. So wherever you're on your health journey, you can be supported by our community. And so just wanted to give a little intro to who we are, what we do, if you're new to our community. And so stay tuned. Again, we do these classes every month on different topics. So you can check out our website, see any upcoming topics that interest you, and plan to log on. So in preparing this talk, I was thinking, what am I going to focus on? And there's so many different aspects to mental health and mental well-being. But today I really wanted to focus on anxiety and depression. Those are the two biggest things I've seen lately, the biggest things people are struggling with. And I also want to remind you guys that any of the tips I talk about today, for the most part, also apply to kids. And we've seen such an uptick in anxiety and depression alike in children, even really young children, that we really just need tools and strategies to help ourselves through this. It's a stressful time, no doubt about it, for everyone. So it's all about what can you be doing on a regular basis to stay in a bit more of a balanced state. And so that's my focus today, is to just bring you guys knowledge and tools to stay a little bit more resilient to all the crazy stuff life is throwing at us recently. So a quick disclaimer before I get started. I want everyone to understand nothing I'm talking about today is a replacement for seeing a mental health professional and being under the care of a mental health provider. So please don't think that this is permission to change medications, do something, replace something. That's not what this is about. So before starting any new regimens, any new supplements, any new protocols, make sure you consult with your healthcare provider before making any major changes. Okay, so I'm going to start with anxiety. We're going to kind of break it down, and then we're going to go into depression. So what is anxiety, right? A lot of people, we hear this term thrown around and it's like, do I have anxiety or am I just feeling nervous? It's kind of hard to tell the difference sometimes. So definition of anxiety, this is from Merriam-Webster, the dictionary, is an apprehensive uneasiness or nervousness, usually over an impending or anticipated ill or a state of being anxious. So I find a lot of anxiety is rooted in being worried about things in the future or things we don't have control over, right? And so perfect example of this is the whole past year, right? And I feel like this is why so many people have seen a huge uptick in anxiety, because so many things were just thrown at us out of the blue that we have no control over. And that's very hard for a lot of people to deal with when just life changes in a minute. So what are common symptoms that show up with anxiety? See if any of these ring true for you. Headache. A lot of people get stress or anxiety headaches. This is incredibly common. Nausea. Anxiety can be very linked to the gut and feeling nauseous. Frequent urination, having to go to the bathroom all the time, right? I've definitely experienced this. Like I remember in school, if I had to give a presentation, I'd feel like I had to go to the bathroom right away, right? So there's a big connect there. Rapid heartbeat. Lots of anxious people feel like their heart fluttering or beating very fast. Chest pain. Okay. Some people even like mistake, they feel like they're having a heart attack and it's like a panic attack. Shortness of breath. Dizziness, feeling lightheaded. Many people experience this with panic attacks. They'll stand up and feel very lightheaded. Excessive sweating. People that just sweat all the time. It's like your body is in that panicked, anxious state long term. Insomnia, problem sleeping. Many people experience this when they're super anxious. It's hard to shut your brain off and you can't sleep. Fatigue, okay, due to lack of sleep or other things, just constantly exhausted, because it's hard on your body to be in this constant state of stress as well. And unexplained pain. This is very common. I'm sure Dr. Carey and any other healthcare provider on here could echo this. People that have physical pain without a mechanism of injury, meaning it's not like you rolled your ankle and it hurts, but you just woke up and your ankle hurts. Many times something like that can be rooted in stress. Okay. And there's many more, but I just wanted to paint the picture of there are so many symptoms that can be rooted in anxiety. So it's important that we look at this and see what we can do to support it. Okay. Now let's go into depression and kind of talk about the difference between the two. So depression, this is also a dictionary definition, is a mood disorder marked especially by sadness, inactivity, difficulty in thinking and concentration, a significant increase or decrease in appetite and time spent sleeping, feelings of dejection and hopelessness, and sometimes suicidal tendencies. Okay. Now, this is where I really want to stress that it is very common at different points in life to experience the emotion of depression. But that is different than having clinical depression. And I feel like many people are like, I'm anxious, I have an anxiety disorder, or I'm depressed, I have clinical depression. There is a big difference. And yes, mental health is a big thing, and we should be supported by the proper professionals. And I feel like it's important, especially for children, that we normalize the spectrum of emotions that are normal to feel. Right. So I'll give you some examples. Death of a loved one, very, very common for people to experience feeling depression when that happens. Loss of a job, okay? Loss of a relationship. It takes time to grieve and like go through that process. World events, right? The state of the world can cause people to feel depressed. Even a hard day, and this is a big one for kids. They have a day, they feel particularly low. Maybe they got in trouble with school or got a grade they're not happy with. And a lot of times I feel like we're quick to own a diagnosis or a feeling or feel like there's something wrong when we might just be experiencing an emotion. So it's important to look at the difference with that. And to me, the difference is you need more support when it's hard for you to come out of that feeling, right? It might be normal to feel sad, feel anxious, feel a bit depressed when you have a rough day. But if you can't come out of that, that's more of looking at maybe a more serious diagnosis. Now, symptoms of depression, okay, this can present in interesting ways for people as well. Trouble concentrating and making decisions, fatigue. So kind of similar, anxiety can show a similar way, but it's very common in depression. People are like, I could sleep for 15 hours and I'm still exhausted. Feelings of guilt, worthlessness, and helplessness. Pessimism and hopelessness. A lot of people experiencing clinical depression just feel like there's no hope, right? They can't see a way out of the current situation they're in. Insomnia is very common with depression. I would say more than anxiety, trouble sleeping too much, like I talked about, just being in general really irritable. This is a big one. Loss of interest in things once pleasurable. So people that are like, I used to love going out with my friends and I'd have so much fun. I'd be out every weekend, with my people. And now that doesn't even interest them anymore, or it isn't enjoyable. That's a big red flag for depression. Overeating, you can go into overeating with depression. You can also go into undereating and having no appetite. Aches and pains that won't go away is a big one. A lot of depressed people also have a lot of physical pain. So there again is like the mind-body connection. So I wanted to kind of just define these two because I feel like that's not talked about enough. We like throw out these terms anxiety and depression, but we don't really clarify what they are. So now I want to go into things we can do to help balance this out. Okay. And how both Dr. Carey and I work is we use the model called the Triad of Health. So what that means, if we think about our health as a triangle, there's 3 sides in a triangle, right? And the 3 different sides of the triangle represent different aspects of our health that can help us be in balance or out of balance. So it's important to address the full triangle instead of piecemealing it, which is what we tend to do. Okay. So the Triad of Health is the base of the triangle is our physical structure. That's our physical body, right? So I'm going to talk about what that means, but think structure, muscles, bones, joints, exercise, movement, that sort of thing. Okay. This side here is biochemical, or I like to simplify it as more nutrition. Okay. So that's our digestion, the food we eat, supplements, medications, hormone balance, inflammation, all of those internal processes working in our body. That's the biochemical side. And the last side is mental health, mental and emotional well-being. So between our structure, our biochemistry, and our mental emotional health, that's like the true holistic model of care that we want to follow. And if one of those is out of balance, they all are. So both everyone at Be Optimal is kind of on board with this. We have to look at the whole of the person. And what tends to happen in society, I find, especially with mental health, is it's very compartmentalized, right? So you'll see a nutritionist maybe to help with mental health issues, or you'll see a therapist, or you'll see your psychotherapist to manage the medication, but everyone is just looking at their one piece of the puzzle. And what's nice about holistic medicine is we take a step back and look at all of it, which is really powerful. So we're going to start with structural or physical health. Okay. This is actually incredibly important and very often overlooked for mental health issues. Exercise. There is huge evidence, research-based evidence that supports exercise for mental well-being. I mean, there's some studies I've seen where it's virtually as effective as medications, as like an anti-anxiety and antidepressant drug. Okay, so this is something anyone can absolutely start doing today. Now it's spring, the weather's nicer, and it's not that you have to go crazy with exercise, but just move your body every day. Intentional movement every day. Exercise increases endorphins. It makes your body make those feel-good hormones. And so it's like the ultimate biohack for your mood. So I want everyone to like reframe exercise or working out, because I feel like that can be really triggering for some people. They're like, I don't like exercising. I don't like working out. I want you to just think about intentional movement, 30 minutes a day of intentional movement. This can look like walking a dog, going on a walk with your kids. It can look like trying out some yoga. Now it's great. Everything can be streamed. Like from YouTube, you can find a free 20-minute yoga flow. Try out a different exercise class, maybe something you haven't done before. This is a great opportunity to try something new. Hiking, go out and hit a forest preserve or a trail, go for a hike. Swimming, dancing is absolutely exercise. Stretching, getting a nice mobility stretch routine going. Take a bike ride. Even playing with your kids. Like, we don't do this anymore, but actually play with your kids at a park if you have kids. Like, go on the monkey bars with them, climb up and down, go on the slides. Like, that is a great way to move your body and a bigger workout than you think. So I want you guys to focus on, if movement isn't part of your daily routine and you feel like you're struggling with some anxiety or depression or just mood stability in general, start getting outside, getting some fresh air and getting some movement in. And I almost guarantee it will at least help some. Okay. Another physical thing that we, of course, strongly encourage is chiropractic adjustments. Yes, Dr. Carey had a great tip, especially for exercise. Have an accountability partner, right? Get with like your bestie or someone else that also wants to, start exercising or moving every day. And you guys check in every day. You text each other like, hey, just got my 30-minute walk in. That can go really, really far. Invest in working with a personal trainer, something like that to kind of put you more on the hook can be really helpful. Okay, so chiropractic adjustments, super, super powerful for your physical structure. So chiropractic not only helps your body feel good and your joints be more mobile and you perform better and posture and all of that. What chiropractic adjustments do is they affect the nervous system. The nervous system is what controls every function in our body, down to our hormones, neurotransmitters. So by chiropractic normalizing the tone of the nervous system, it helps your mood and it helps get your body out of fight or flight response. And that's like when you're anxious, when you're like, go, 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 like the adrenaline is pumping. Chiropractic calms that down. So we have patients on a very regular basis report after their adjustment, many positive things, but one of them being that they just feel like chilled out. Okay. And that is what a lot of us need these days. So chiropractic can be very powerful to help manage mood. Yes, Dr. Carey said it's hard to feel motivated when you feel down. So if you're having like a low day or you're feeling a little off or not so great, that's where it's like really great to have that accountability partner that you can reach out to and just be like, hey, I'm having a low day. How can I get past this? And they'll be like, you got this. Just get outside and go for a 10-minute walk. So really powerful to have people like your cheerleaders that are on your side. Okay, another thing that can be very helpful, kind of similar to chiropractic, but a little bit different, is bodywork or massage therapy. Okay, some people just, and you probably know if you're this way, respond so well to human touch. Like it's very healing, very calming, very therapeutic. If you are this type of person, getting regular body work can be very, very powerful for your mental well-being. It helps your body rest and restore. It also is a great endorphin release. So those of you that love massage, you feel like $1,000,000. Dr. Carey got one today, right? Probably instant mood lifter after you get a massage or get some body work done. And physical touch is also proven to be very helpful for anxiety and depression. Right? There's studies done on just like getting a hug releases oxytocin and can lift your mood right away. Massage is the best, like an hour-long hug. So definitely add that to your routine if that's something you're able to do. It can be very powerful. Some people just, I think, receive healing and self-care better with touch. Okay, so that's some tips for physical stuff. Next, we're going to go into nutrition. Okay, so we're going to talk more about this in a little bit with supplementation, but there's no way to sugarcoat this. What we eat absolutely affects how we feel physically and emotionally. So if you really want to go at stabilizing your mood, feeling better, feeling lighter, feeling less depressed, less anxious, diet is also something that is not necessarily easy to shift, but it will make a huge impact. And I would argue probably the biggest impact out of anything you can do would be diet. Like if I could have you guys start with one thing to help support your mood and how you feel on a day-to-day basis, it would be through diet and nutrition. Okay, so first I'm going to talk about the things to avoid, then I'm going to talk about what you do eat, okay? So we always talk about the 5 things we want you to avoid. These are like the big fish that pretty much anyone would feel better and more stable if they removed these from their diet. So number 1 is sugar. If you are going to pick one thing, make it processed sugar, hands down. Definitely increases anxiety and it pulls the body into a depressed state. Literally, it lights up the same area in the brain as like class 1 drugs. It's very addictive and affects our mood in a really, really significant way. So I'm talking processed sugar, like the stuff in candy, processed and packaged foods, desserts, cakes, all of that. So processed sugar is a big, big one to cut out. And it takes a while. I will warn you, the first few days, you might feel headachy, you might not feel great. but you get through it like 3-4 weeks, you more built a habit, and it actually hugely helps with cravings. I recommend anyone, even if you feel amazing, a couple times a year, go sugar-free for a month. It'll help just like level you out and kick the cravings. So processed sugar, number one. Number two is wheat or gluten. Okay, not everyone has a gluten allergy, but wheat is very inflammatory, and it basically completely rips up the gut microbiome, which, as we are learning, it's really cool. There's more stuff coming out every single day about this, how important the microbiome is directly related to our mood. There is a huge gut brain mood connection. We should probably do a whole webinar on this. Let us know if you want that. But it's huge. It's huge. Your body cannot even make the feel-good neurotransmitters if the gut is unhealthy. So for that reason alone, among many, I'd recommend taking out wheat or gluten. So that's breads, pastas, crackers, cakes, anything that's made with flour is going to have gluten in it. Okay. Next one is corn. Corn is also very, very harsh on the digestive system. You know this because you know when you ate corn, when you go to the bathroom, it comes out whole. We literally cannot break corn down in our system, and it just rips up the gut. It's a grain. We tend to think about it as a vegetable in this country, but corn is actually a grain, and it's fed to farm animals to make them fat. That's just the truth of it. So look out for corn. It's in a lot of things. A lot of people don't think they're eating corn, but then when they look at labels of certain things, there's corn in a lot of stuff that we might not realize. Gluten-free products contain a ton of corn. Many of them are just made with corn flour, which then has its own issues. So you're just better off staying away from like packaged goods in general. Okay, soy is the next one. Soy in this country, like many things, is not made in the most healthy way. It's usually packed with a bunch of preservatives and other ingredients. Most of the research that's done on the benefits of soy is done on fermented soy, which that's not what we consume. And that's what they consume more in Asia. And soy is meant to be a condiment and a very small part of your meal, not a complete protein replacement. And what soy can do, especially when it's poor quality, is it's a big endocrine disruptor, meaning it can majorly disrupt your hormones. So it can affect the thyroid, it can affect the hormonal system. So especially for women, but honestly for anyone, we have a huge estrogen problem. Most people are too high in estrogens. And so this is definitely something to remove. So it got really popular a while ago as a dairy replacement, which is a good thing. People were realizing that dairy was causing some issues. But now that we know more about soy, like ditch the soy milk, go with like an almond milk or coconut milk, something like that instead of soy. Okay, last but not least of the 5 is dairy. Okay, dairy is very inflammatory. Many people notice as they get older, they tolerate dairy less and less and less. It's because as we age, we stop creating enzymes that can break down dairy. So while it's inflammatory, a lot of kids can have dairy with no problems. Like they don't necessarily get a lot of digestive upset. But as we get older, it's harder and harder on our system. We just can't break it down because we are not cows. We are not genetically cows. Our bodies do not make the enzymes to break down cow products properly. And so it's going to cause havoc in other ways. Dairy is usually more like factory farm raised. The animals are pumped full of antibiotics and extra hormones to make them lactate all the time. Like, think about that, right? Cows aren't breastfeeding 24/7 their entire life. They just are nursing when they have small calves, but we pump them full of hormones to produce milk all year round for their whole life. It's really kind of crazy. So like, think about what we'd have to do with adults to make them do that. So it's just not great. We're not cows. We're not really meant to consume cow dairy. So I'd recommend swapping that out. Now, some people can pivot and do more goat-based dairy products. So goat milk, goat cheese, raw is better. Stuff that's not pasteurized just hasn't been messed with enough. Like, there's a lot of evidence to support our ancestors consuming raw dairy and they were okay with it. So you can look into that. But in general, it's smart to just minimize dairy where you can. Okay, so those are the 5. So to recap, sugar, wheat, corn, soy, dairy. The big fish, I would go for sugar if you want to start small. But those are the 5 biggies. Okay, so now what's left? I know I just took away so much that you probably consume. So what do we eat? Okay, protein. Protein is the building block of every cell in our body. It's very important to eat adequate protein. We need it to repair. We need a full spectrum of amino acids to feel good and to stay balanced. And so if you are choosing to eat more plant forward or vegetarian based diet, definitely talk to us about that. There's ways you can do it in a more balanced way, but it takes a lot of work. There's stuff like seed combining. You can supplement amino acids to help your body out, but it's very, very important if you are vegetarian to make sure you're doing it that way, or it can derail your health in other ways. Okay, vegetables. Of course, eat vegetables. Everyone knows they're healthy. We just usually don't eat enough of them. Healthy fats. Fat is very important, especially for hormone balance. And so fat got a bad rap in the 90s because of the whole cholesterol, low fat craze, but fat is good. Eating good, healthy fat does not mean fat on your body. There's a big difference. And this is one of the biggest like myth busters that we talk about every day with our patients, but we're talking about healthy fats. Okay. Fats from things like avocados, olive oil, coconut oil, fish, nuts and seeds, right? Things like that. Not talking about like cheese and dairy or deep fried foods or, margarine or things like that. So more the anti-inflammatory. And you guys can look this up, just Google and look at images of omega-3 fats. And you can see a list of foods that are very high in those. Fat is also really amazing because it gives you the biggest energy bang for your buck. So if you're looking like, I only have a few minutes to grab a snack and I'm not going to be able to eat for another 5 hours, you want to go for fat. That's going to last you the longest. You slam half an avocado and a handful of almonds, you'll be good for 4 hours. Versus, we tend to go for carbs, right? You have a cookie or a bar or even a piece of fruit, and probably in 30 minutes to an hour, you'll be hungry again. So fats can really help you feel stable. A lot of people's mood stuff is just from being hangry. So blood sugar imbalances. Okay. And fruit. Now with fruit, I would say I don't like to label any food as good or bad, but some people do tend to eat a ton of fruit throughout the day. And what I will say is if you're struggling with energy, focus, concentration, mood, anxiety, stuff like that, back up on the fruit and focus on more protein and fat. Fruit is no doubt way healthier than candy and cakes and processed sugar type things, but it is still sugar. If you eat a whole large banana, there's a significant amount of sugar in that. And if you don't have any fat or protein with that to help balance it out, you're going to experience a bit of a sugar crash, just like you would if you had a sweet treat. So watch that. I like to tell my patients, never eat a naked carb, and fruits are carbohydrates. Okay. So if you're going to have a banana, have some almond butter with it. If you're going to have an apple, same thing, nut butter, have a handful of trail mix with it or half of an avocado, something like that. But try and think you always want to add protein or fat to a carbohydrate. Okay, so that's diet stuff. Now, I want to talk about some of my favorite supplements, stuff that we love to use in the office for folks experiencing anxiety, depression, any sort of mood imbalance, because people love to ask us about supplements. So the first one I'll start with that isn't necessarily, might not seem related, is a couple. Okay, this is called Megaspore Biotic. Okay, it's a spore-based probiotic. We have it at the office. We could do an entire series of 10 talks about this product, but to make it simple, this is a spore-based probiotic. It's physician grade, and spores are super resilient. 99% of probiotics on the market die before they even get to your intestinal tract, which is where they need to do their thing. So all they do is kind of cause a pH shift and can kind of temporarily make you feel better, but they're not actually reestablishing the microbiome like Megaspore Biotic does. It's amazing. They've got incredible research behind it. Put it this way, after we discovered Megaspore, we stopped selling any other probiotics. So it's just the best. So if you're feeling like you want to work on some of that gut mood connection, Megaspore is the way to go. Okay. And we recommend people start slow with this. It is strong because it's physician grade. You have to get it through a center like ours. You can't just find it on Amazon. So start with like one capsule or half a capsule even a day and work your way up. And feel free to shoot us a message if you need some guidance on that. Okay. Next one. This is called Mega Omega. It's an omega-3 fish oil supplement. Okay. There's actually been studies on high quality fish oil improving mood. And so many people are incredibly omega-3 deficient, and it affects your brain. So that one is like a no-brainer. I mean, among all the other amazing anti-inflammatory effects and all that from the fish oil, highly recommend starting that, just adding it to your daily regimen. That is one. And probiotics, these are probably the two most important supplements that you go quality, quality, quality. If you're going to splurge on a supplement, make it fish oil or a probiotic. Please do not take a fish oil from Costco or CVS. It is not going to be good. Okay. It's your fish oil is only as good as the fish. And if it's made from factory farmed fish, it's going to be full of chemicals and all sorts of junk. So you want to make sure fish oil especially is incredibly pure. So seek a good quality fish oil out from a like trusted healthcare provider. That one's really important. Okay, next, this is one of my all-time favorite supplements for patients. It is called Lavella by Integrative Therapeutics. And what this supplement is it's lavender oil in a capsule. So many people have heard lavender is very relaxing, right? Like all the spas use it. It's in sprays and oils and care products for good reason. Lavender has a very calming effect on the body. So for you folks with anxiety, this would be a great thing to try. And it's also very benign. It's really, really safe. I give it to kids all the time as well. So what it is according to them, you take one in the morning, one at night, but decide what's best for you with your healthcare provider. And they actually studied this supplement. They did a clinical study and did Lavella versus anti-anxiety medication. And the Lavella actually performed better. So it's really amazing. And it's also not going to interact with any drugs. So it's something you can safely add to your regimen. It's really awesome. Okay. Next, this supplement is called Hpa Adapt. So a lot of what happens with, especially anxiety, is there's something called the HPA axis, the hypothalamus in your brain, the pituitary in your brain, and the adrenal glands. Okay. To make this very simple, those three different areas talk to each other and decide how your body responds to stress. Okay. So what this helps do is it's a combination of different herbs that help kind of regulate that system and bring it back into balance. So it's going to really help people that maybe their circadian rhythm is really off. Maybe in the morning they're super, super tired, and at night you're wide awake. That's a big signal that something in that system is wrong. Okay. Maybe you just feel like drained all the time. Like this one has really helped some of my patients with energy. So it's a great one to just help balance out that kind of endocrine system. This one oftentimes goes along with that one. It's called Cortisol Manager, also by Integrative Therapeutics. And cortisol also is a huge player in anxiety. So cortisol is a stress hormone. All right. Many people have heard of cortisol, and it should follow a pretty predictable pattern throughout the day of its concentration. So in the morning, cortisol should be nice and high. It's what helps you wake up. Ideally, you should wake up without an alarm pulling you from being unconscious. You should wake up nice, be ready to go for the day. And at night, it's fluctuates during the day, and at night it really drops off, which allows your body to come down and secrete melatonin and rest. Now, many people where their circadian rhythm and everything is just kind of off, which this can hugely impact your mood, as you could imagine, it's reversed. So in the morning, there's like no cortisol. So these are the people that are like, I could sleep for 15 hours and I would still be exhausted. There's no cortisol happening in the morning. And at night, it spikes again. And many people have experienced this. I have too. If I push myself and stay up too late, I get like a second wind. And then you're up for another 3 hours and can't fall asleep. Very common. So what this supplement does is you take it in the evening and it helps manage that cortisol. It helps lower cortisol at night when it should be coming down. And the really cool thing is I've really seen it help to restore people's circadian rhythms back to normal. So that's a great one. Okay, next, serotonin. Okay, I haven't really talked much about this yet, but serotonin is a very important hormone we have to help mood. stability. Okay. Very common, people that experience depression is their levels are too low. What this can help do is help naturally raise your serotonin levels. Now, with this one, very important, don't just go order it. Only do this one under the care of a physician. This is contraindicated, meaning do not take it if you are on antidepressants. Okay. So this is more people that are like, I feel like I could really use some extra support. I'm not on medications. That's more something you could try. But with a lot of these, you're going to get the most bang for your buck getting on an individualized protocol from a healthcare professional like myself, like Dr. Carrie, etc. So I just want to give you guys ideas, and I more want to empower you guys. If this is only like the things I thought of off the top of my head immediately. There are so many ways that holistic medicine and supplements can support you to stabilize your mood. And I want people to understand you don't just have to feel horrible and get to a point where you're so bad and you have to be medicated. There are steps you can take to help balance out your system. Our belief at Be Optimal is that any symptom, anxiety and depression included, is your body communicating to you that there's an imbalance of some sort happening. It's our job as the providers to help you figure out what that imbalance is. And when you restore balance to the body and give it the right things, it balances out. It's pretty amazing. So all of these things can complement that. Okay, last thing, I just want to talk about a couple of essential oils. These are amazing, totally safe, great for kids, great for anyone, just a great tool to have on hand when you're having a moment, having a low day, or feeling really anxious. Okay, the first one here is called Present Moment Oil. This is made by Vervita. They make amazing essential oil blends. So this is a blend of many oils, and it helps you do just that, be present. So remember when I was talking about the definition of anxiety, which is like worrying about things in the future you can't control, basically. Present moment helps you get present. If we can truly be present, there honestly isn't that much to be anxious about. We're usually worrying about things in the future or rehashing stuff in the past. So present moment is great. I'll even have patients literally just use it, open it up, smell it, take a few deep breaths. It helps bring you down. But other ways you can use oils, you can diffuse them. If you have a diffuser, you can get one on Amazon for $10. Diffuse while you're working, while you're stressed out next to your computer. It helps, those feelings of calm and presence. You can put it in an Epsom salt bath. You can apply it topically. You can even, under the direction of a healthcare provider, disclaimer, you can ingest these orally. Some patients will take a drop. You can put a drop in a capsule and swallow it. So essential oils are amazing when they're good quality. This is another one. Absolutely do not buy oils from the grocery store, from Amazon, etc. It's important to realize the supplement and oil industry is not regulated by the FDA. So basically anyone can make anything. They only have to put like 1 drop of actual essential oil in a whole bottle to call it essential oil. And they can actually say things like pure without it even being that. And then they add a bunch of chemicals and fragrances. It's really scary. So especially if like you've had reactions to oils before, it probably was because it wasn't good quality. Okay, so really look into that. So Present Moment, Vervita, amazing. Last one I want to talk about, this is another brand of oils we really love, high quality Young Living oils. This one is called Stress Away. This is a really, really nice scent. It smells almost tropical. It's kind of like vacation in a bottle, is how I like to say. So again, keep it on you. You can make a roller out of these. You can just smell them. You can diffuse, put it in a bath, whatever works for you. But some people with their bodies, like I am this way, I respond really, really well to aromatherapy and scent-based stuff. So if I'm feeling stressed, just by diffusing something, or I'll put a couple drops on my hand and just smell it and like take a couple minutes of deep breaths, that can shift my mood, my energy, how I feel really, really quickly just by smell. So amazing stuff to just have on hand to support. And I will say from experience with my own daughter, essential oils are probably work the fastest and best for her out of anything. So that is a great thing to start bringing into your home if you have kids you want to help support. Is essential oils. You can put it on like the bottoms of their feet if they're having a tantrum, if they're having a rough day. It's awesome. Okay, last piece of the Triad of Health to go over is emotional mental wellness. That's why we're here today. So I want to just talk about a couple of different practices that can make a huge impact for mental well-being. So the first is to start a meditation practice. Now, the first thing I want to do is let's take a step back, take a breath for a second. This doesn't mean you have to have an hour sitting on a fancy meditation pillow every day and chanting. Okay. A lot of people have a big stigma with meditation, like, oh, I can't do it. It's not for me. What I will say is meditation is not about shutting your mind off. That's actually not the point. Our minds are designed to go in a million different directions. It's about just being present with your thoughts so you can more view them as like an observer than being caught in the crazy spiral. So a lot of people, you just need to take the pressure off of yourself. It's not that you can't meditate or you can't shut your mind off. Like no one can do that. So don't think that's what it's about. It's just about being still for a couple minutes, really, and giving yourself the gift of even 2 minutes a day. It's actually, if you guys aren't following, please follow Daryl Jones on Facebook and Instagram. He's an amazing meditation expert. Like I just know enough to be dangerous. He's the best. But he talks about how it's actually like proven that 2 minutes of meditation a day is way more effective than if you were to meditate like 3 times a week for an hour. It's about a daily practice of just calming your mind, sitting, taking a few breaths. So like half the time, all I do is I turn on an app. My favorite meditation app is Insight Timer. It's free and it can just function as a timer. So I can set it for 2 minutes and put on rain sounds or chimes, or they have all these lovely sounds. And it just like dings when 2 minutes is up. And I just focus on my breath. That's all I do. I really like to do 4-7-8 breathing. So you breathe in for a count of 4, hold for a count of 7, and exhale for 8. It kind of gives you something to think about, which I appreciate. Another great way to start is by guided meditations. So you guys can look up 5-minute guided meditation on anxiety. There's a bajillion on apps, on YouTube, etc. Guided is really helpful because someone is actually telling you and cueing you what to think about. So taking you through like an imagery exercise or something like that. That's an amazing way to start. So some amazing meditation resources. Yes, on Instagram, you guys can look in the comments. Dr. Carey put revdaryljones.com is his website. He does a lot of amazing meditation events too. Check his stuff out. It's the best. But there's an app and website, Chill Anywhere, that they have amazing resources on meditation classes and recordings and all sorts of stuff. Insight Timer, like I said, is a great free app I love. Headspace is another good one that kind of takes you through a journey from beginner meditators on. So I would definitely encourage you to take up a meditation or mindfulness or breathing practice, whatever you want to call it, but wake up 2 minutes earlier to give yourself a couple minutes to breathe. It'll hugely pay off and like set the tone for your day. And think about what time is best for you. Like, for example, my husband, he loves to meditate at the end of every day. That works better for him and really helps him sleep better and feel better than in the morning. So it's also experimenting, like, you know yourself best, what works for you. Okay, the second thing I want to talk about is a technique. This is more a practitioner-based technique called Neuroemotional Technique, or NET. Both Dr. Carey and myself practice this and are certified in NET. It's an unbelievable technique that really helps work with the subconscious mind. And so when we're talking about things like anxiety and depression, almost all of what's occurring is subconscious. Okay, we get triggered and we don't even realize it's happening. And then all of a sudden you're having a panic attack, right? That's just like the nature of the beast. And so what NET does is helps find what those subconscious triggers are and helps release them from the nervous system. So it's not that it's going to erase a memory or change things or whatever. It's going to help how your body responds to these situations. So I want to give you guys an example of that, so it'll hopefully help it make more sense. Let's say someone is let's say a kid, okay, is hugely triggered by going to school. This is actually super common. Okay, so kids feel super, super anxious, getting ready for school. They're pulling up to school. They have a horrible stomach ache. That's almost always anxiety in kids. Like they just get triggered just by pulling up to the school building. Right? They haven't even been in school yet. They don't even know that it's going to be a bad day. It's just a trigger, right? So what NET does is can figure out what that's triggering. Because a lot of times, especially for kids, but even adults alike, you might not even know It's just like, I feel super anxious when I have to go talk to my boss or whatever it might be. So what NET does is helps identify the trigger. And then we also can figure out where this started. Many times when we're triggered, it's from younger or previous experiences. So maybe a kid is really scared and anxious about going to school because 6 months ago, there's a class bully that's really mean to them, right? And so until they can get over that original trigger, it's going to keep resurfacing. And so what NET does is it works with the acupuncture meridian system to help find those triggers. And we do a really gentle release, which is just with some breathing and touching different body points that helps remove that trigger. So what that means is moving forward, the body won't be so physiologically activated when that stress comes up. Because with that school example, your kid is still going to go to school and that bully is still going to be there, but they shouldn't be as triggered into anxiety because of that, if that makes sense. So NET is an amazing technique. We use it for mental health on a daily basis. I use it with virtually every patient, and it's super effective and an awesome thing to add on to support yourself. So you guys can also head over to our website, beoptimal.com, beoptimal.com, and you can go to a link that says, check out our videos. And we actually have a video. It's of myself doing an NET session on a patient. So you can actually see it in action and see how cool it is and how quick and easy it is. Definitely check that out and think about if NET is right for you. All right, so that's about all I had for today. Anyone throw up any last minute questions? I will hop off the live stream and go on to Zoom for those of you on Zoom that might have questions. But the last thing I want to mention is if you want to learn more, especially about anxiety, this coming Sunday, I'm doing a webinar. It's a 90-minute webinar, Sunday evening at 7 p.m. Central, all about natural ways to heal anxiety. So I'll be talking extensively about the physiology, why anxiety happens in the body, what hormones and neurotransmitters are big key players, and then what we can do about it. So it's going to really paint the picture and give you guys all of our best tools and strategies to manage anxiety for adults and kids alike. It's only $30. So it's going to be about 60 minutes of intensive, like we're going to plow through some stuff because I want it to be super information heavy. And then there'll be about 30 minutes for Q&A with both myself and Dr. Carey. We'll both be online for that. So you'll get the recording, even if you can't catch it live or can only catch part of it. I highly recommend. It'll be an invaluable tool for yourself and your family. So the registration for all of that is right up on our website. You can find it right under our events and our offerings and sign up for this Sunday. So unless there's more questions, I will hop off and we'll call it an evening, but I hope this was helpful for you guys. Again, follow us on social media, share this if it was helpful for you. We do these talks every month and we love it. We love to help everyone as much as possible. So have a good evening, you guys.